So there's a whole bunch of ways to answer that, but I want to answer it as simply as I can. It's not up to me to figure out what integrative means. It's really up to the clinician. And as long as there's a way to capture the data on what they do, then they can do it. Now there has to be some basis for having an understanding that it works. So we've all been introduced to things that we're like, I don't know about that thing. And some protocols work. Some people who practice protocols of one kind or another, they're better at it than others. So this is all data that's actually pretty relevant data. And because we're working with self-insured payors, we're not stuck in the paradigm that commercial insurers are. These are ERISA plans. Mind you, I consulted on $100 billion of retirement assets around the world, so most people consider me an ERISA expert. And really, if a ABC gigantic company, Fortune 50 company, wanted to pay for, they can pay for whatever they want. And then if you embed that language in the ERISA plan document, you actually have a very interesting tool.
Do you know if any of these plans or programs or companies are open to exploratory documentation or research to take a look at some of the other alternatives that are unexplainable?
Good question. I generally don't have that kind of conversation with them. The conversation that I would have would be more like, so we want to have anyone who's got a state license that's able to treat somebody in some capacity, to be able to be part of the thing, and the data will shake out as it needs to. And I have that conversation with them because if they're like, well, don't we need randomized double-blind controlled studies, then I have to go into why randomized controlled double-blind studies are too self-limiting, and so it's not really up to us. The thing that we're most concerned about is safety. So that's not a hard issue in this space, right? So then if the practitioners practice something and they can record the procedure so that we can capture the data, and oh, by the way, that patient ends up being way better off than when they walked in the door, and by comparison to how conventional care treats it, now we begin to gather the evidence that that particular practitioner practicing that particular protocol is effective. And if I'm a CFO, that's what I want to know. We're not in the trying to pick winners and losers world, because we're not clinicians. We're data informatics, which is, by the way, it's no magic. The FDA is not a data informatics regulator. Yes.
So everything is just plain.
Yeah. What is that?
In talking with a representative from Michigan just about an hour ago, one of the things I think that we're going to have to assume a responsibility for with integrative and comprehensive health care, we're going to have to assume the responsibility of being able to help them discern what integrated therapy would be appropriate for their particular diagnosis. And I think that's a responsibility we're going to have to assume, because we know how the therapies work with different kind of medical diagnoses. Does that make sense?
It does.
We can't ask them to integrate and they don't know where we fit.
Right.
Yeah.
And the way that I think of that is, if we have some of the best integrated medicine folks in the country treating patients because they're involved in our demonstration projects, I mean, you know how it is, right? If you have 20 different patients and there's 3 or 4 diagnoses that are part of the demonstration project, I'm probably going to end up monitoring 20 different ways that the various clinicians treat the patients. That's okay, because there's more than one way to skin a cat, and I think we all know that. And if the real bogey is, how does that compare to using conventional care? So we may end up with these 4 protocols are really the most effective of the 16 or 17 that we've seen. And so if I'm a CFO looking at that, my response is going to be, I'll waive deductible, I'll waive copay. Let's drive all the patients with that diagnosis into that level of care by those practitioners, so we actually think of ourselves as being a driver of business into the door of the integrated medicine practitioners. And that would be one of the reasons why they'd want to participate in the data collection, is we help build their business just by being able to prove that what they do works. I think there's a whole bunch of other folks that just showed up. Thank you very much for sitting and patiently listening.
Thank you.